Hi, this is Josh. I'm a pharmacist with pharmacisttips.com, here to talk to you a little bit about the difference and similarities between Meloxicam and Aleve. Meloxicam and Aleve, or the active ingredient in Aleve known as naproxen, are both what are called NSAIDs. NSAIDs are non-steroidal anti-inflammatory drugs. They're used to treat pain and inflammation, used in arthritis a lot, osteoarthritis, rheumatoid arthritis. Naproxen also has indications for mild gout flare-ups, fever, pain, and other pain and inflammation. They're both best taken with food as they can both upset the stomach. So the difference mainly between the two, Aleve taken twice a day, meloxicam usually once a day, but sometimes twice a day. Meloxicam may be a little bit easier on the kidneys, maybe some of the less uh, of a risk of the kidney function problem where you can start to retain fluid and the increase in blood pressure that you can see with all the non-steroidal anti-inflammatories. Um, the meloxicam may have a slightly lower risk of stomach and GI issues like ulcers and bleeding. Leaves still kind of mild on that spectrum of stomach issues, but the risk may be slightly higher than meloxicam. And meloxicam, it looks like, has a slightly lower cardiac risk, slightly lower risk of heart attack, stroke, that sort of thing. And then as far as pain relief, it's kind of dependent on the person. They're both very good at reducing inflammation, but for whatever reason, some people may notice one work better than the other. Neither one is inherently better than the other. Oftentimes people have to try one, and some people respond better to one or the other. Now, with all NSAIDs, there's a warning. All NSAIDs can cause some issues that we need to be aware of. They all can cause some bleeding in the stomach and intestines, especially long term. This is something you need to be well aware of if you're using these medications long term. And they can also increase the risk of heart attack and stroke, probably due in part to that kidney effect where they can retain some fluid, and that pushes up the blood pressure and causes all sorts of problems in the body. So be sure that you discuss with your healthcare provider the risk versus benefits with these medications. Like I said, the occasional use, probably not a big issue. It's more the long-term use. And again, when monitored closely, many people can use these medications for a long time without issue. I do appreciate you watching. I'd love it if you'd subscribe to my channel. If you appreciate the information I provide, always talk to your doctor or pharmacist before using an NSAID, especially long term. If you have a question for me, go to pharmacisttips.com/ask. Thank you.